Could your chronic health conditions be related to a bacterial infection? Today, I'm going to talk about the top 5 bacterial infections that could cause long term chronic illness.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician in Utah. On this channel, I share with you how you can treat your body naturally and then eliminate symptoms without harmful drugs or surgery. Make sure to subscribe to start your healing journey. I recently filmed a podcast with my co host, Teresa, and where we talked about the top 5 bacterial infections that could not only cause acute issues, but also lead to chronic illnesses. We also talked about one of these very common bacterial infections that you usually get when you're a kid that could lead to long term chronic illness. So stick around till the end where we're going to talk about that. Number one is Borrelia burgdorferi, also known as Lyme disease. So, how do you get exposed to this disease is through a tick normally. Now, there's a lot of debate among the experts in Lyme disease and physicians like myself. Is it absolutely only coming from a tick, or can it come from other sources?
Mm.
I know that I was looking at some research and listened to a German doctor that they started to find that there was Borrelia burgdorferi actually hanging out in horseflies. So, and then there's debate is it could be coming in mosquitoes and etc. So it could be coming in other areas, but the general consensus among the medical community is that it's coming from a tick. And what you will expose when you first get exposed to it is you usually experience a fever, a fatigue, you get a headache, and then you could potentially get erythema migrans, which is this bullseye rash. Now, you don't always experience those symptoms when you do get exposed to Borrelia burgdorferi. This is the acute symptoms that are usually linked to it, but you could be exposed to it and really just have just a general malaise or general cold-like symptoms that you experienced, like just maybe fever and chills, and you didn't really experience anything else, and you could have been exposed to Lyme disease. And you don't absolutely have to have a rash to have been exposed to Lyme disease. This is just a specific indicator that you have been exposed to Lyme disease. And we know for sure that it was Borrelia burgdorferi if you have that bullseye rash. But if you don't have it, you could still be exposed to it, and it could still potentially lead to long-term issues in the future. So if you don't treat Lyme disease, it could even cause more severe things. It could go into your nervous system, like in your brain. It could go affect your heart, and it could go into your joints. So it's not something you really want to mess around with. If you get exposed to Lyme, you usually want to treat it aggressively and really take care of it. So with chronic Lyme disease, you can experience a lot of the symptoms that I just said. But it's chronic. Like some people that have chronic Lyme disease can even experience fevers off and on all the time. Every day they have fevers that come and go. And they can get chronic headaches. Very common that chronic migraine headaches can be related to chronic Lyme disease. Now, it can also affect the heart, the nervous system, the joints, by making your immune system go crazy. So a big area I want to talk about is the immune system, because Lyme disease likes to affect the immune system. And that's what makes it really difficult to make a confirmed diagnosis of this disease too. And what it makes it very difficult to eliminate, because it suppresses the immune system and kind of eliminates itself away from the immune system. So it's not able to be killed by it. Also, what it does is it can make hyperstimulate the immune system and make it go a little crazy. When I say that, it cross reacts with proteins throughout your body and causes autoimmune diseases. Like I said, it likes to go after the joints, so it could cause rheumatoid arthritis. It could be a cause of other autoimmune conditions that cause joint issues like lupus. Like I said, it goes to the brain and the nervous system. It could cause autoimmune stuff in the brain and the nervous system, and this can cause all kinds of issues, also leading to peripheral neuropathies, the chronic headaches, the brain fog, not able to think well, memory issues, you name it. All kinds of things happen there. And then it can affect the heart. Autoimmunity of the heart can even happen and cause this chronic pain in your heart, and it doesn't work very well, and arrhythmias and things like that. So Lyme disease is such a horrible thing. But just because you have been exposed to Lyme, I know a lot of the people in the East Coast are like, I've been exposed to tons of ticks, and that means I'm going to have this chronic illness. Not necessarily. There are people that are more susceptible, or they could have really stressful events and things that can happen that suppress their immune systems, that make them more readily available for that Lyme disease to reactivate itself and cause problems. Now, there are people that get exposed to Lyme, they have the acute symptoms, and then they have the chronic, and it just keeps on going forever, and they've never been the same since being exposed to Lyme disease.
Are there people who might have a number of like symptoms that suggest possible Lyme's disease, but never recall ever getting bitten by a tick?
Yeah, so you can even get exposed by what's called these nymph ticks that look like just little freckles or a little speck of dirt on your skin, and you just knock that off with your fingernail, and they're gone. And now their head's hanging out in there, and you might not experience any specific symptoms. Like I said, the main symptoms that you experience are the fever, the chills, the headaches, and fatigue. Now that can be related to all kinds of different diseases, right? So it's really hard to really know for sure. Now you know for sure if you've had it, if you get the bullseye rash though. That's very specific for Lyme disease.
Hmm. And I know I interrupted you.
Yeah.
So,
So treatment wise, how do we do this? What do we do for it? So let's say you got acutely exposed to Lyme disease and you want to know what to do. So you could go the conventional route, which is very common, and I'm not anti this because you really want to be aggressive. Is you do doxycycline, and you usually do this for about 21 days. And you take that for 21 days, and then you usually don't have to do anything if you do get it early on, and make sure you take care of that. And that's going to hopefully prevent any of the long-term chronic illnesses that could happen from Lyme disease in the future. You could also do other things, like you could take natural antibiotics, like artemisinin is one I really like. Berberine is really great. Garlic. You really want to take high doses of these things. I would take these things for about 2 months if I got exposed to it in that circumstance. So you choose what you want there. But when I'm prescribed doxycycline for this, I'm pounding with good probiotics during this period to make sure it doesn't destroy the gut too much. But sometimes it is the best thing to do when you acutely get exposed to it. Now, when we're going after chronic Lyme disease, I am not a guy that loves to go after the antibiotics. Now, I do go there sometimes for patients that aren't responding with other things, but it's a rare occurrence. And it's not about just going after the bug itself. I see a lot of Lyme disease doctors, they're going with a ton of antibiotics, doing IV antibiotics. They're doing it for several years, even, which obviously is going to have all kinds of side effects to it. But I understand what they're trying to do is eliminate this chronic bug, but they're not working on what's been damaged by the Lyme disease. They're not working on again, I say it affects the brain, and we call that neuro Lyme, and that can cause the headaches, the peripheral neuropathies, the brain fog, etc. All these things can happen. Is You need to work on healing up the brain. And it causes damage to the heart. We need to work on healing up the heart. What about it damages to the endocrine organs like our thyroid and our adrenal glands and our sex hormones? There's many times imbalances of those hormones all the time when I see people with chronic Lyme disease. So we want to work on balancing those things out, treat those specific areas, work on healing the brain, healing the gut, the endocrine organs, healing the heart, and helping decrease that inflammatory response, helping in the joints. So we go after and prescribe natural treatments to kill the bugs. Like I said, the artemisinin and the berberine, the garlic. And I like to do IV procedures. If it's chronic, I'm almost always doing IV procedures. It's very difficult to eliminate chronic Lyme disease without being more aggressive. Like I do IV vitamin C. Many times I do IV ozone, and I do photodynamic therapy and all kinds of things. I like hyperbarics to start healing the body. So a lot of things we're doing as a treatment protocol to help those people that are dealing with this chronic debilitating Lyme disease.
and I know that we're going to go into this further on another episode where we're going to really dig into, all of the detailed effects and how these treatments work and so forth. So, for those of you who are listening and who know people who have Lyme's or wondering if you have it yourself, because some of these conditions that he already mentioned are ringing a bell, stay tuned for that, and we'll also give you a way to reach out to Dr. Jake as well. Okay, number two is sounds somewhat familiar with some of the words, but definitely interested in learning more about this common bacteria that we see in the states, and that is Mycoplasma pneumoniae.
Yeah, number two, Mycoplasma pneumoniae is not probably one people have heard a lot about. The previous one, Lyme disease, yeah, it seems like people have heard a lot about this one. But Mycoplasma pneumonia could cause just as many problems as Lyme disease, unfortunately. So, but what you do is you get exposed to it, and many times you can have a cough, bronchitis, you get fever, chills, you can get a headache, you could get a little bit of a runny nose. So hard to know if you actually got exposed to Mycoplasma pneumoniae or all kinds of other bugs, right? But those are the acute symptoms that you get exposed there to that. So acutely, that's what you're going to experience. Let's talk about what you do in the chronic scenario. And many of these can be very similar when we're talking about the chronic scenario, because what it does is it will affect your immune system. So Mycoplasma pneumonia does have an affinity for the lungs, but that doesn't mean you're only going to have lung issues. And people that have Mycoplasma pneumonia doesn't mean that they have shortness of breath or cough long term. It will affect the immune system, and it can cause all these autoimmune conditions or neurological issues when you're exposed to this, because you could. So what you can have is what's a reactivation of the bug. So you get exposed to Mycoplasma pneumoniae, you have those acute symptoms, your body eliminates it, great, and it could go dormant for a little bit, and it's just hanging out there. And let's say you have a really stressful event, or you have to take a steroid for some reason, or whatever happens in your life that suppresses the immune system a little bit, and then this bug can reactivate itself and cause all these chronic issues, the autoimmune stuff that leads to all kinds of different symptoms. Like it could cause the joint pains, the chronic headaches, the brain fog, the memory lapses, the arrhythmias, the chronic digestive issues, constipation, diarrhea, gas, bloating, affect your thyroid function, adrenal function. All these type of things can be functioning, having issues, because it affects your whole entire immunological symptoms system. And when you do that, you're going to affect all these different organs. And you might have these certain diagnoses, which are just symptoms, and we give them a name. But that's not really what's really going on. And you could have all these different diseases going on, and it could always have just one culprit. Maybe it's just Mycoplasma pneumonia. Typically, what I see when people have these chronic illnesses that reactivate, they are related to all kinds of different bugs. They many times have other bugs that we're going to talk about hanging out in there, or others causing a lot of these issues. So treatment wise, very similar to Lyme disease. And a lot of this is going to be very similar because these are all bacterias, and we treat them
Mhm.
in a similar way. We go after them with the berberine, the artemisinin, the garlic, etc. And then all the other procedures that I talked about with Lyme disease.
And then I imagine, what you had mentioned with the limes, it's first eliminating the bug that is causing all of these chronic issues, and then I imagine spending time repairing the body from the damage that it caused, right?
Definitely, and I do it all in unison. So it's not like just going after the bug and then healing the body. You got to do it both, because you're never going to eliminate the total bug if you don't let the body heal. And your immune system's not going to. You need to let the immune system heal. So if you just kill off the bug, I don't think you're ever going to get there if you don't work on healing the body at the same time as eliminating the bug.
So you have 3 more on this list. One question that I have right away is when somebody's coming in with just a ton of chronic conditions and you've got multi-organ issues happening, all sorts of problems, it seems like they're just a big wreck. Do you test for all 5 of the bacteria that you're talking about today, or do you tend to kind of go with the gut or the symptoms to pinpoint maybe 1 or 2 that you start with? What's your process?
Typically, I do. If we're going to be talking about one that I don't order all the time, I'm going to rule that out when we get to that. But I usually, yeah, if someone's coming in me with all these chronic illnesses, autoimmune diseases, chronic fibromyalgia, chronic fatigue, chronic headaches, I want to rule these things out because these are very common source of the cause. So I always want to eliminate that. So if I forget, let's say I don't test these bugs, and I start saying, okay, I see all these other issues, and I don't find out that their bugs are there, they're just not going to get better. So if they are having these issues, I usually test them to make sure that they don't have them.
Excellent. Okay, so the next one is definitely one that I heard about in my college years, but I haven't really heard much in my adult years. I'm eager to hear what you have to say about that, and that is chlamydia trichomonas.
Yeah, chlamydia trichomonas. This is the one I was talking about that I order all the time. I check their history because they are going to have symptoms of this disease. So I'm going to check this out. So this is a sexually transmitted disease, and many times will cause a type of discharge in the sexual regions, the vaginal area, and in the penis. So those are the acute symptoms that you present with, and chronically you can present with these type of symptoms. Also, it could cause fever, chills, body aches, these type of things, and then burning in the genital area is very common when you have this. But this can cause all kinds of immunological issues, so it's something we definitely want to always rule out when I'm looking at someone with the chronic illness scenario, the autoimmune disease, the chronic fatigue, or whatever's going on, because it could be a source of what's going on. We need to make sure we eliminate this, not just because it's very disruptive and it can be a big issue, It's because this could cause all these chronic issues. And many times the approach is very similar to the other bacterial infections that we talked about.
I mean, when somebody has it, they catch it acutely. I imagine, I mean, that's a symptom that
Yeah,
is obvious. They go and they get an antibiotic, I imagine, from their doctor.
definitely.
Does it
Hmm.
work the same way in that your body, it's not quite eliminated, it just goes dormant, and that's when
Yeah,
it can come back
yeah,
later,
it
to
can.
wreak havoc?
Like a lot of these other bugs, it can just go dormant. Let's say you took an antibiotic and you've never had an issue before. It could potentially later on in your life, let's say 10 years later, reactivate itself and be an issue again. And you could maybe experience some of those acute symptoms or not. And you're just having these autoimmune things going on. So that's why it's really good to make sure you just test it. If I see that it's in your history, I'm going to test it and see if it's just showing that there's reactivation of that bug
Where does bacteria hide when it's dormant?
just in your tissues, your bloodstream. This
I
hangs
think
out
that
in there.
it's interesting because I know for me, I've heard about viruses, being dormant, and
Mhm.
that they hide out in the nerves or things like that. But this idea that bacteria can do the same, is that the case for all bacteria? That all bacteria in a sense really just goes dormant, or is it specific types of bacteria that are more inclined to go dormant and then come back?
I think that's a great philosophical question. Do all bacteria not totally eliminate from the body? And we don't really absolutely know that. And there's so many different theories, like the germ theory and other theories on infections themselves. But these bad ones definitely do go dormant and reactivate. Do all bacteria? I don't know. That's we don't know enough in medicine yet about that.
Interesting. Okay, your next one has a similar name, but a different bacteria, Chlamydia pneumoniae.
Yeah, so chlamydia pneumoniae, totally different than its trichomonas. This is a lung illness. It causes a lot of the symptoms similar to Mycoplasma pneumoniae. You are going to have the cough, the fever, the chills. You're going to have some bronchitis. It can many times cause a headache and extreme fatigue. And sometimes this one can be a little bit worse than Mycoplasma acutely. You could have this chronic cough that's been hanging out for a really long time and it's just not clearing. That's the acute scenario. In the chronic scenario, just similar to all the other ones, when it does get reactivated, when it is in the chronic state, it's going to mess with your entire immune system, going to make your immune system angry, and it's going to affect all your organ systems. And it's going to have variable symptoms with it. You could have the joint pain, maybe you have the brain fog, maybe you have thyroid diseases going on like Hashimoto's thyroiditis. Maybe you have some disruptions of how your ovaries are working, imbalance of estrogen progesterone, affects your gut, etc. All these things get messed with because it causes this chronic inflammatory response. And then certain areas get affected and other areas don't. And you present with a certain symptomology. And that is the underlying cause is that chlamydia pneumonia. So we always want to look that up. And like I said, many times, if you do have a reactivation of this bug, I almost very commonly see that you have another bug hanging out there because the reason why you had a reactivation is your immune system got suppressed. And many times people get exposed to all kinds of bugs and then they reactivate themselves. And that could be related to a lot of their chronic illness.
Yeah, it seems like it's like a perfect storm, right? Like you just one makes you more susceptible to the other, and the next thing you know, you've got all sorts of things happening because your immune system was so messed up in the first place. Okay, last one. This one is very surprising, and I know that you had mentioned earlier for us to stick around because it is quite common and one that we see a lot of kids get. And I had no idea that it can come back later on in life. And that is what I typically heard of when I was a kid was called strep throat or strep. Tell us about
Yeah.
that.
Yeah. Number five is strep. It's very interesting. Yes, almost all of us get exposed to strep throat, right? The acute symptoms that we experience with this is that you get the sore throat, you get the fever, you get the chills. And what's really interesting is you can know if you have strep throat is if you don't get the runny nose. Now, there's a
Mm,
very small amount that do get a runny nose, but let's say you have a fever and a sore throat and you don't have a runny nose. I wouldn't That's when I'm like a red flag, probably strep. And usually it's a really high fever and it's usually hanging out for a while and it's hard to clear. That's usually strep throat. This is spread through contact, like the saliva. It also can be the mucous membranes can expose it there. So that's how that's exposed. We didn't talk about the others, like the lung infections. Those are spread through respiratory droplets. So if you sneeze or cough, it's spread that way. But this one's spread mostly through contact, kind of like mono is
I
in that way.
remember when I was a kid, the my mom taught me that the sign if you knew you had strep if you saw the white specks on the back of your throat. Is
Yeah,
that a
yeah.
wives' tale?
Yes, you do see white specks, but not everyone does, and you can see red spots. That's more of an indicator. Now, you do get these little pustules in the mucus, white pus being made, and that's very common too. So that's one way to really know. Or if you look at the tonsils and you see a lot of these little red dots, like on the surface of the mouth and on the area, that's most indicative. Now, someone
Okay.
else can have pustules and things, but I would definitely, if you did have that, I would definitely go and
Yeah.
get checked for strep. And it's a big thing to go check for strep because it's well known that this can cause all kinds of problems if you don't really get it treated correctly. Now, there's a lot of people that don't get antibiotics for this and don't necessarily have issues, but it's still probably a good idea. And usually, when people do come to me with strep, I'm many times prescribing penicillin for this. I don't want these chronic issues. Penicillin is extremely effective for this, and it's one treatment we know it works very, very well for strep. And I don't want it to hang out and lead to scarlet fever or joint issues or heart issues that can happen when this doesn't get treated appropriately.
I think that's really I think what differentiates you from, a lot of other doctors is that you do have an integrative approach. And while you are cautious about antibiotics, and we've done other past episodes on natural antibiotics, and so forth that can be very useful, but we don't need to use and overuse them the way that we have in our culture. But there is a time and a place for them. And in a
Mhm,
situation like this, where that there are dire, major consequences that can happen if not treated. This is one of those cases where,
mhm,
antibiotics might be the better choice. So
mhm.
a child gets strep, parents give them antibiotics or don't give them antibiotics. If they give them antibiotics, is the chances of it coming back later possible, or is it only for the ones that were not treated properly?
So there is chances that it might come back again if you do treat it appropriately. So that's an unfortunate thing. And I don't want to say that just because you've been exposed to strep, because almost all of us have, you're going to have these chronic issues and these autoimmune issues, or chronic fatigue or fibro or whatever, all these things that can happen from this chronic illness. It usually happens that there's other things going on. There's something that's suppressing the immune system, and people that are prone to it can have all kinds of issues that happen to strep. So I don't want to cause anyone a lot of anxiety, lack of sleep, because they've had strep and oh no, I better do something about it. And I'm just going to freak out about it because and most people, they're totally fine. But some people, it could be a big problem and we need to check it out. And what big thing about chronic strep, and I see this often, is it likes to hang out in the joints. So people that have autoimmune diseases that are hanging out in the joints, like rheumatoid arthritis or lupus, you want to absolutely check out chronic strep because I see it very often. Now, I see it with all kinds of other autoimmune conditions or people that just have chronic fatigue and don't have any joint pains or whatever. But if someone has joint issues, I definitely am taking a look at chronic strep because it's very commonly involved, and I'm seeing this involved all the time recently. I'm seeing a ton of yeah, strep infections be related to a lot of the chronic illness that I see around right now. So it is an issue. I wouldn't freak out about it. There are people that are having issues, and we treat it very similar to all the other bacterial infections that we talked about, and we treat it aggressively when it is in the chronic state. Another big cause of chronic illnesses are viruses, which I look at when I'm treating my patients. So click on the video to the right where we talk about the top 5 viruses that could be causing your chronic illness. I'll see you over there.